There are a variety of reasons for the early reclining of the casualty to the angle required for a Route 1 longboard extrication to the rear. The first one is that the casualty's face in the sitting position is close to any undeployed airbag that is within the steering column, and reclining the casualty will help remove them from that danger. By reclining the patient using inline stabilisation, someone to take the weight of the seat back and someone else to wind the seat back, you can remove the patient's head from danger. The greatly increased distance means that it is safer for both patient and rescuer, who can now do inline stabilisation from the side, also allowing for assessment of the airway, breathing and responsiveness of the patient, as well as giving eye contact, which will help reassure them. Another reason for early repositioning of the seat is to show that the back can actually recline past the B-post, which may intrude as a result of the crash, or the seat mechanism itself may be distorted. Not all seats, of course, will recline backwards, and some are electrically operated, the power to which can be jeopardised by damage to the battery in the accident or by firefighter activity. If you discover that you cannot recline the seat and at the last minute, the only option will be to lift the casualty vertically upwards against the longboard, an unacceptable practice in a severely traumatised person. Fire crew may offer to remove the seat back, but whilst this is relatively easy to undertake on old cars on a training ground, in modern cars the use of high-strength light alloy steel and the electrics going into the back to provide airbags, heating and movement may well make this a very difficult task indeed. If you cannot remove someone via Route 1, then a side removal or B-post rip is the better option. With an extrication device applied to the casualty, the longboard may be introduced 3/4 to the rear and the casualty extricated on it. Another reason for lowering the seat urgently is to bring the brain into the same horizontal level as the heart. This reduces the distance the blood has to ascend vertically, improves the mean arterial pressure at the level of the brain, and consequently the cerebral perfusion. It is, of course, a routine practice in anyone that is hypotensive. There is another advantage, though, from putting the casualty into this position, and it is the fact that it extends the abdominal cavity and allows the organs to move into the position that they will rest in throughout the rest of the healthcare pathway. When bleeding occurs within the abdomen, initially it will be at normal blood pressure, but as the blood pressure falls and the blood accumulates in areas where the movement is reduced, it will clot, helping to maintain the final blood pressure and possibly save the life of the casualty. Blood clotting consists of 3 mechanisms. Initially, exposed collagen will cause a reflex vasoconstriction, which helps minimize the blood loss from the area. The exposed collagen and von Willebrand factor attract platelets and cause them to adhere to the damaged collagen. The platelets degranulate and release cytoplasmic granules, which contain serotonin, which acts as a vasoconstrictor, ADP, and thromboxane A2. Thromboxane A2 causes further degranulation and vasoconstriction, and thus there is a positive feedback which results in the formation of a platelet plug. Note how blood clotting products are being attracted to the clot from the circulation, diminishing the quantity that remains in the circulation. Coagulation then begins to occur. The damaged tissue releases factor 3, which in combination with calcium forms factor 7, and this is the extrinsic system. Factor 12 converts to factor 11, producing factor 9 and factor 8. This is the intrinsic mechanism. Both factor 7 and factor 9 combine together to produce factor 10. Factor 10, factor 3, calcium, factor 5 and PF3 all work together to initiate prothrombin activator. Prothrombin activator, converts prothrombin to thrombin, and thrombin converts fibrinogen to fibrin. Initially, there is a loosely held mesh of fibrin, but under the influence of factor 13, this mesh forms strong covalent crosslinks and forms a dense mesh which traps further red blood cells and platelets. Note how the blood clot is causing the blood remaining in the circulation to contain less clotting factors. Clot, when removed from the abdomen, is fragile and delicate and can easily be disrupted, as shown in this model demonstration. It is important not to disrupt the initial clot, for if it is further disrupted, then it will not form as successfully again. Once in the position, the extended position for the longboard to be inserted, further organ movement is minimized as the casualty is extricated.